Hey everyone, this is Derrick Broze of the Conscious Resistance Network, and today we are going to continue our conversation about COVID-19 case numbers in Houston, Texas, and really elsewhere, but we're focused on Houston. For those who are aware, I live in Houston, Texas. I'm from Houston, Texas originally, and I'm still here for the moment. And while I'm here, I am going to continue to do investigations and researching these topics. And just to clear things up, I am a journalist. I do take my words seriously. I'm not out here trying to make claims that I can't prove, but I am coming at this with a sense of skepticism and not simply just repeating or buying the claims that are being put forth by the mainstream corporate media. So I hope that's clear to everybody. Before we get into this, I'd like to remind you guys to bookmark my website, theconsciousresistance.com. I'd also invite you guys to come over here and check out our icons. You can see now we've changed up all of our icons of where you can follow us. We got Float, we got Minds, we got Hive, we have our text list. You can find videos at BitChute, at Library. You can support via Patreon, and if you'd like to join my Telegram channel where I post lots of news, you can do so right there. And of course, if you want to support us, you can get some Kratom via My Brave Botanicals. So this is going to be a continuation of the video I did the other day, our case numbers being manipulated in Texas, #COVID. This was just 4 days ago, and examining some disturbing reports regarding the spike in COVID-19 cases in Texas. And as we covered in that video, there have been reports from Collin County Commissioner Court, which is here in Texas, where they put out this presentation, which, by the way, guys, somebody said the presentation link was down. It looks to be working for me. They put out this presentation in late May. It started to go viral over the last month or so, I would say, as people started to recognize this. And I'm not going to rehash what I did in that last video, so if you wanted to see that, please go back and watch the previous report. But what it comes down to is basically this presentation, which was put together by members of the Collin County Commissioner Court, says that not only are, based on new numbers that came out on May 11th, that the number of COVID-19 related deaths is going to increase because of this new case definition. And they explained that. We went over that and everything. They showed how, like, the new probable case definition, even though one person has tested positive for a PCR swab, up to 15 other people or 17 other people could be found to be probable cases. And we went over that whole thing and how that change took place. So before we go further, though, I want to show you this clip. This is from Governor Greg Abbott here in Texas, where he is asked about this case count. So check this out.
I'm glad you asked because the way the data is provided by the State Department of Health Services, it provides one column and one single category for those who test positive for COVID-19. It provides a separate column and a separate category for probable cases. The two are not intermixed at all. The reason why we are seeing a spike in the number of cases is because there are more people testing positive. If someone is tested positive, that means that they are confirmed positive. And the probable cases are a different category altogether.
Thank you very much for making that clear. Lastly, death rate declined over the past month. How significant is that compared with hospitalization?
Okay, so I think you guys could hear that. Look, that's the governor of Texas. He's claiming that the probable cases and the confirmed cases are not mixed. I also found this report from Texas Scorecard. State officials say Texas coronavirus cases counts exclude probable cases. They are tracking probable cases, but is not included in those counts in the total number of confirmed cases. If this is true, then our fears or concerns about, as you can see over here on the side right here, they have this report, Texas' new coronavirus criteria could artificially spike Collin County cases. Apparently, the state of Texas decided they were not going to follow that procedure, and that is through the Texas Department of State Health Services, the DSHS. They decided that they would not follow this recommendation. So here's again the quote from the interview I just showed you guys. And Collin County Judge Hill raised the issue at May 18th, said the changes could significantly and artificially spike cases, and that's from the presentation I showed you right here. The presentation by Aisha Sori, an epidemiologist with Collin County, explained the new case definitions. And so they go on to say further, though. Right here it says, the state has assured us they are going to be reporting positive confirmed tests and probable cases separately. So we take them on their word from now on. They're going to be separating those into two categories. And if you go to the official Texas, the DSHS website, let me see if they have it pulled up here. It says, like, right on their front page, we right there, as you can see. Probable cases are not included in the total case numbers because I think that they realized that people were concerned about this, and so they changed it. Now, maybe the original intention was to count the probable cases with the confirmed cases. As you can see right here at the bottom, look at the bottom left of your screen right here, guys. Probable cases are not included in the total case numbers. So that's what they're saying. And as you can see over here, according to this Texas website, Harris County, where Houston is, we have the highest case numbers. Doesn't mean we have highest deaths or anything of that sort, but we have highest case counts. So what I'm trying to say to you guys is it appears that the CDC did at one point recommend that, and this, even if you're not in Texas, I would recommend going to look at whatever website you have similar, let's say Florida Department of State Health Services, whatever the equivalent of that is, go look up their website where they're counting cases and see if there's a disclaimer that says that they are not counting probable cases. If not, it's possible that your state, your county, etc. could be using the CDC recommendations. So we go here to the CDC website, COVID-19 data and surveillance. What is a probable case? A probable case is defined as a person meeting clinical criteria and epidemiologic evidence with no confirmatory laboratory evidence. So these are the various ways you can be considered probable. A person meeting presumptive laboratory evidence and either clinical criteria. A person meeting vital records criteria with no laboratory testing. Now, to order to understand that, you'd have to click all these links, and I've done that myself to really understand what do they mean by that. What is clinical criteria? What is considered presumptive laboratory evidence? I went over here to this other one. Here's the case form that if you're going to report somebody with COVID, this is the form that you would do it. The CDC human infection with 2019 novel coronavirus case report form. Is it a lab confirmed case? That means detection of SARS-CoV-2 RNA in a clinical specimen using molecular amplification test. Right there. Is it a probable case? If it's a probable, select the reason. It meets clinical criteria, etc., etc. So that's the definition I just showed you right here. This is just the actual form. So I want to tell you this, guys. I did call the Collin County Commissioner's Court, and I spoke to a source off the record. I can't tell you who, because that's what off the record means. You're just going to have to trust me for those who trust my work. I spoke to somebody there who was directly involved with the Commissioner's Court. That's all I'm going to say, and who had knowledge of this presentation. And what they told me was, yes, this is true, that originally they were told that Texas was going to be counting probable cases. And this came from the CDC's definition. And they told me the CDC's definition, and this is something I'd never heard of, comes from this organization called the CSTE. The Council, let me see if I can find the exact definition of it. I have it written down. Give me 2 seconds, guys, and I'll pull this up for you. I wrote this down in my own notes. Oh, I don't have it. The Council, something, I can't remember what the S and the T stand for, but it's epidemiology is the last one. But this council they're apparently the ones who decide the definitions that the CDC use. And you can see here, Thursday, April 9th, CST interim position statement, COVID-19 case definition. This is when they first announced it. Said this interim position statement includes standardized criteria. Let me zoom in a little bit. For case identification and classification for COVID-19, including asymptomatic infections. This case definition was developed and led by a core group of CST members with work group representatives from the Association of Public Health Laboratories and subject matter experts at the CDC. And the statement can be found here. You can click it there, and basically it's the same thing. So my point is, this is where the CDC gets their position statements. If you want to dig further on this, and I plan to do this for another video, we need to look into who funds and who is the Association of Public Health Laboratories. Obviously, we already know the CDC. We need to look further into the CSTE themselves, because they are the ones who are setting the definition, which is then passed down to the CDC, and then from the CDC goes to state officials. And yes, if this Collin County presentation was true, which by all intents and purposes it seems to be true, that it was true that at one point in May, the Texas state counties were being told that they needed to count probable cases together. Now, maybe after Collin County blew the whistle and sort of brought this to people's attention, they decided to change that, and now Governor Greg Abbott is having to go on TV and say, hey guys, we're not counting probable cases. So, at least for the moment, guys, like I asked in this video, are case numbers being manipulated in Texas? The answer could still be yes, but more specifically, Are probable cases being counted as confirmed cases? I would say, at least for this moment in Texas, no, they are not. But because most states are following the CDC recommendation, which comes from the CSTE, your state might be counting probable cases as confirmed cases. It's up to you to do the research to go find out. So I hope what I've just shared has been informative to you. I also want to say that in the last day or so, they've announced that military medical reinforcements are arriving in Houston. Today is Tuesday when I'm recording this. They said they just arrived in Houston on Monday. I'm about to leave and go drive to this place in Houston to see where these military medical reinforcements are, if I can get any information. I'm doing my journalistic due diligence. I'm calling them, I'm leaving messages, I'm sending emails saying that I'm from a radio station here in Houston, which is true, and I'm trying to get more information. And you would assume that they would want to get that information out there. But I'm also going to show up there. We're going to film some of these military medical reinforcements. There's also another hospital, at least one, where they're claiming that they had to use a refrigerator because their morgue was overflowing. So we're going to get to the bottom of this. I do not believe, like many of my followers, that this whole thing is completely a charade. And if you've listened to my reports since February, I've never once said that I think this is fake. In fact, I've gone to great lengths to debunk the idea that this is 5G and other things. I don't trust the case numbers. I don't trust the tests. I don't trust the people running the show, because we know that many of them are connected to Bill Gates and to the Rockefellers and a lot of other powerful institutions that have a stake in trying to direct this. But that doesn't mean I think this entire thing is fake. I have reached out to friends who are working in the hospitals, and some people have told me that things are very calm. We don't have a lot of patients. There's a lot of hospitals in Houston, though. They might be at a hospital that's just not busy. But as far as this story that every single hospital in Houston is overrun with people, I can tell you that's not true. Now, there are certain hospitals that are saying downtown in the medical center that are overwhelmed, and I'm trying to get in touch with them. I'm trying to reach out to the doctors who about 2 or 3 weeks ago said that, they were not being overwhelmed and they had plenty of room in the ICU, and see if they still feel that way. But the thing is, we have to understand, guys, even if we're skeptical about COVID-19, which I am, the way that real science is supposed to work is it evolves. So if they say something 1 month or 1 week and then it changes, I don't think we should point that to like, oh, look, they're lying to us. Maybe they are playing with our heads, but maybe they're just getting new information. And I just think we should understand that. So again, I don't think this is completely fake. People are sick with something. I think that it's been highly exaggerated as far as the death rate, the fatality rate. But then we also have to consider the fact that these studies and other people are saying people are coming away with lung scarring. They're coming away with other forms of permanent damage. And then, again, on the skeptical side, we have to consider and understand that they're also saying, guess what? Antibodies don't work. Herd immunity doesn't work. And maybe because this is something new, I think this goes towards the fact that this is an engineered virus, that we have a lot of evidence. I know those of you who think that this is all fake will disagree, but I think that more and more what we're finding out is that this has been engineered. It's been engineered to attack our body. It's been engineered to not be able to achieve herd immunity or antibodies. And this is me speculating right now, just in case that's not clear. But that's what I believe. I think that we're still closer to the point of this being some sort of engineered thing. And we've also, if you remember, guys, they've been saying since this started, oh, we found one strain on the East Coast. We found one strain on the West Coast. We found some different strain. And in China's been reporting they have some new pneumonia. So, I mean, there could be multiple things going on right now. And perhaps one of the strains is extremely weak, like we've been saying, and perhaps others aren't. We need to stop acting like we know what's going on, my friends. And when you just clown on people that are afraid of this or worried about this, we're not helping our case. If you're truly trying to wake people up and you're truly trying to educate your brothers and sisters, then maybe coming at them with derogatory statements and laughing at them isn't the way to do it. Because we don't know. Any channel, any person, any doctor, any medical professional, any TV pundit who's claiming they know what's going on is full of shit. And that's for the mainstream and the alternative. Because this is evolving so quickly, the situation, that we don't know what's going on, guys. But I appreciate all of you who are following my work as I try to dig and get to the bottom of this, now that Houston appears to be the epicenter. Thank you so much for watching. Until next time, remember, you are powerful, you are beautiful, and you are free. Peace, my friends.